Welcome back this noon. The flu bug won't be the only potential health threat Americans will face over the next few months.
John Lawrence shares new data revealing although COVID-19 levels are relatively low nationwide, they are on the rise.
You can't call it a comeback because the coronavirus never really went away.
COVID is still here, like it's been here throughout.
As schools across the country reopen for the fall and Americans face the latter half of the calendar year, the Centers for Disease Control and Prevention says COVID-19 hospitalizations have been climbing since early July.
The community levels go up, and then we start to see the hospitalizations come up afterwards.
The Chicago Department of Public Health says it's seen roughly 72 cases per day within the last week. That's a 4% hike from the week before.
I'd go a whole 12-hour shift without seeing any. And then in the last, 1 to 2 weeks, we see 3, 4, 5, 6 COVID positive cases coming in.
Health officials say although COVID-19 hospitalization rates are at a high not seen since April, they're much lower than before. The CDC says roughly 1% of hospital beds in U.S. inpatient and intensive care units are currently taken by COVID-19 patients. During the Omicron surge, more than 20% of all beds were occupied. Although U.S. cases have dropped significantly since the peak of the pandemic, health officials are advising people to be cautious and fully vaccinated because COVID-19 is here for good.
It's probably not going to go away.
I'm John Lawrence reporting.
The CDC says less than 33% of the U.S. is fully vaccinated in all states except Maine, Massachusetts, and Vermont.